Hi, welcome everyone. I'm Dr. Premkumar. I'm a senior consultant urologist at Fortis Hospital, Nagarbhavi. And today we have had this session and a discussion about men's health, mainly men who are above 40 years. What are the problems men above 40 years will face, and how do face the issues, and how we can tackle, particularly concerned about urological issues. That is the topic for the day we have selected on. So we all know men above 40 years will have a particular group of or particular set of problems which men starts facing because of the age, because of the problems which arises because of the age. Multiple issues are there. I would only concentrate mainly on urological issues. The urological issues would be what age of 40 years will impact on the kidneys, on the bladder, and the urinary system, on the hormonal problems, along with other issues. So, first thing I would want to have impact or main concern about is the urinary passage or urinary system. Main thing, because of the 40 years of age increases, the prostate gland, which is is the only organ in the male, which is only male, which can start going in a higher level of their size. So they keep on increasing in size and causing urinary symptoms, which are particularly frequently passing urine, getting recurrent urinary tract infections, getting problems with the urine speed, frequently getting up in the night, that is we call as nocturia, burning sensation which can happen, and very frequent visits to the bathrooms. All these can happen because of the slow enlargement of the prostate or recurrent urinary tract infections, which is because of the prostatitis. So this can be initial stages of prostate enlargement, which on a longer duration, maybe another 40, another 5, 10 years or so, maybe during the age of 50 years or 60 years, they can start causing an impact on the urinary flow, causing retention of urine not completely going out in the passage, so that they can face difficulty in emptying the bladder, difficulty in pushing the urine out. So all those can happen in the age above 40 years, and which going forward after 40 to 50 and 60 years, these are the problems they can face because of the prostate issues. Apart from that, very early development of erectile problems, erectile issues. These are the important things which I wanted to stress upon. Because above the 40 years of age, people will start developing the general metabolic syndrome issues like diabetes and hypertension. Along with the diabetes and hypertension, the problems which can happen is because there of the impact of diabetes and hypertension on the prostate gland, and impact of these conditions, diabetes and hypertension, on blood vessels. So blood vessels can start becoming narrower and narrower, and that can cause problems in the heart-related issues. It can cause narrowing in the tubules of the heart, which can lead to problems with the cardiac functions or myocardial infarctions and heart attack, what people say. So these are the stages which they start developing diabetes and hypertension related, and along with related cardiac issues. Whenever there is a blood flow problems in the heart, we know that there might be a problem with the blood flow to the penis and the genital organs and the ear lobes and the fingertips and the toe tips of the toes, all that things. So that can cause impact on the blood flow to the genital organs, and that can lead to erectile problems in males above 40 years. There can be hormonal changes which can happen in males above 40 years because of the testosterone, the amount of testosterone produced in the testes and starts to decline. So with the decline of the testosterone levels, the erectile dysfunction is increased. The chances of becoming a father will also decrease because of the decreased blood supply to the testicles. The hormones come down, the FSH and LH will start increasing because of the testosterone coming down. So all that can impact on the sperm generation, sperm motility, and the fecundity or the fertility of a male can come down after 40 years of age. Along with these, apart from that, we have other issues related to, as I said, diabetes and hypertension. Stress levels increase. As the stress level starts increasing, the chances of renal stones increase because of the anxiety, Because of the anxiety, the water intake can be either too much or water intake can be too less. And the kidney functioning can also affect because of the decreased water intake, can have stone formation inside the kidneys and blockage of the urine tubes, blockage of the blockage of the bladder outlet, and that resulted in blood started to start coming in the urine and related issues. So urinary disturbance, bleeding in the urine, difficulty to pass urine, repeated urination, all these are combined factors. Maybe it's not one factor which can cause, but usually what we have been seeing in our clinics is above 40 years, these are the problems we start seeing in patients. Particularly patients who are diabetics, they start the most common presentation in a age of 40 years with diabetes is with belnoposthitis, or what we call as infection of the skin covering the glands pars, and that has become a first sign of diabetes mellitus. Earlier, it was frequent urination and burning sensation in the passing urine and in passing urine, and getting up in the night was the frequently sought out probable initial signs and symptom of diabetes. But nowadays, we see belnoposthitis as a initial symptoms or presentation with the diabetes. So whenever we get a diabetes test done, which is in the form of HbA1c and blood sugar levels, we see a constant on a regular basis. Maybe around 70 to 80% of people who present with infection of the penile skin, they are found to be diabetics. So these are the common things we have been seeing, and this there are all these are all treatable. And I've been having some comments coming in. uh, I'll just answer as and when the question comes here. So there's a question here asking who are prone for infertility, either male or female, according to me. See, being prone for infertility depends completely. We have 30 categories. Infertility can be 30% because of the male, 30% because of female, and 30% unrecognizable, the both male and female. And there are 10% of people who also who have infertility without known causes. So these are the divisions we find in for infertility. Male factors mainly is because of the radiations, because of the blood supply to the testis being abnormal, because of the varicoses, the blood supply, the free radical damage to the testicles are more. The diet, if it is not good enough, too much of usage of laptops and internet and phones, and too much of heat generating job when they are involved in. And as I said, 40 years, above 40 years, the testosterone hormone production comes down. So all these are factors concerned to the male. In females, there are other factors also, like females having polycystic ovarian diseases, where the normal ovulation is not properly happening. Ovarian disease happens because the ovaries will be releasing the eggs, and the eggs will not completely reach the tubes and into the uterus. So those unreleased eggs will start becoming a cyst. So that indirectly means that the ovulation is not properly happening. So PCOD is one of the important risk factors for infertility in females. So I would say there will be a balance between, I could in simple terms, I would say it is a 50-50 chance of male and female being reasons for infertility. Diet and habits which can help in urological health. Okay, so urological health, diet, though there is no specific diet for urological health, in a general terms I would say plenty of water intake, because any functioning of human body needs water. All the enzymes, all the hormones, to be functioning in a proper and optimal level, body needs water, because water is a very good medium for all these enzymes to work. And the same water intake is important for functioning in the form of urine production, taking out all the waste products from the body and taking it out in the urine. If the water intake is not proper, urine can't take out all these waste products from the blood and drain it off. If the water intake is not optimum, you can start having high colored urine or dark colored urine and concentrated urine, and that can lead to formation of stones inside the kidney. So water intake is very important, one of the very important factors which I would say. Exercise is also important, because the blood circulation in the whole body is always maintained with a good exercise, particularly cardio exercises, which will help for a constant blood supply to the kidney, so that The blood supply and blood pressure is maintained, and amount of blood reaching the kidneys is always constant. Too much of relaxation, too much of sedentary work kind of thing will have hamper the amount of blood going to the circulation, and heart will have more work to do against a very sedentary lifestyle. If the working and activity is always there, the peripheral heart, what we call the calf muscles, will keep on having a pump from the lower part of the body. The hands will pump from the extremity, so that heart will not always take up the whole functioning of pumping the blood and taking it back. So taking it back to the heart, if it is done properly by the hands and legs, to heart, the impact on the heart is very less. So exercise is very important. And another thing which is as for habits, in general habits, I would say water intake, smoking. Very most important factor is in a age about 40 years and above is the amount of smoking which has been done. So that the smoking will cause lot of problems in the form of peripheral arteritis, and causing decreased blood flow to the testicles, to the kidneys, and it can impact on the sperm motility, sperm concentration, and infertility. Along with that, because the blood supply comes down in smoking, the penis will also have a lesser blood supply, which can cause erectile dysfunction and also lead to cardiac related issues also. So these are the important factors: water intake, diet, exercise, and avoiding habits which are detrimental to the general system. They can also impact on the kidney functions. I have another question here. Frequent urination and night urination increase with age. Okay, so I'll answer the question in pieces. So frequent urination and urination at night, it increases with age, particularly I would say more than 60 years. Why? Because frequency can be because of a condition called overactive bladder. Too much of anxiety, too much of work-related issue, too much of stress faced all through the day can also cause frequency of bladder contractions. So bladders have become very active and they start contracting unnecessarily without urine also being there. So that leads to frequency. And nighttime urination, we have seen nocturia is one of the important factors for an elderly people, particularly elderly male, because the urination, the water intake in the night sometimes are more, and the fat around the kidneys. It's a very detailed analysis which I'm telling you. So nighttime, why elderly people will start having urination is the fat around the kidneys and around the vessels of the kidneys will start coming down, and the prone position, or the way the kidney lies down, the blood supply to the kidneys will continue to be there, and the veins compression will continue to happen, and the amount of urine produced will increase because of the water intake taken in the night. And also elderly people will have lesser sleep in the night because of lesser activity in the morning, in the daytimes, so that the sleep patterns are very varied, and the amount of sleep they can get in the night is decreased. So they are woken up for very minor stimulus, and that because of, along with the blockage being in, if prostate enlarges in the elderly male patients, and that causes urinary passage blockage, the bladder would start passing urine or pushing the urine against a little resistance. When the pushing of urine against resistance increases, the bladder starts becoming overactive. The muscles start becoming thicker, and that causes a lot of contraction and irritation of the bladder. So the frequency increases because the bladder is very thick, very strong, and it can start pushing. Even with a little bit of stimulus in the bladder muscle starts contracting, and that causes increased frequency and nighttime getting up. Another part of the question was that um, is burning urination always a infection related? Most of the times it is infection related, but even in the case of bladder outlet obstruction, where the prostate is enlarged or the bladder neck is very tight, and the process of urine emptying in from the bladder, that causes stretch of the neck of the bladder, that causes irritation, and that is how burning sensation happens. I would say maybe I'll put it at 90% chances that burning urination is 90% because of urinary tract infection, 10% because of obstruction caused by either prostate or previous scars formed by the urinary tract infection at the neck of the bladder. Another question coming here is any diet restrictions in urological problems? There is no diet which can help in prostate related issues, because prostate related issues are completely genetic, and it is because of the enlargement of the prostate and mechanical blockage of the urinary tract. So no diet will help because it is completely genetic and it is individualized. There is no common diet for anyone to follow. But to prevent secondary effects of this passage problem or the prostate related issues, we can have timed avoiding, so that only every 2 to 3 hours urination can be practiced regularly. Water intake has to be adequate, so that 2.5 to 3 liters of water per day is required for a normal functioning of the body and waste disposal of the body through urine as well. So that part is good. Excessive amount of red meat, excessive amount of salt, excessive amount of green leafy vegetables, excessive I'm meaning, and excessive amount of tomato, cabbages, and these are the dietary factors which can lead to a lot of salts coming inside the urine, and that salts coming inside the urine will lead to stone formation. So that diet has to be followed, with restrictions of salt, restrictions of heavy consumption of red meat, heavy consumption of tomato, cabbages, and green leafy vegetables, particularly palak. So those diets have to be followed to prevent stone formations. Uh, Another question coming in is, what are the warning signs of drug-induced kidney damage? Drug-induced kidney damage, the warning signs are very, very minimal. We can't have any diagnosis made by taking any drug particularly. The only thing is we can do investigations in the form of urine routine and renal function test, which includes serum creatinine and electrolytes, which can help us to identify if the kidney functions are getting damaged. Mainly because the drug-induced kidney damage happens because of prostaglandin level being low. That causes the pain-killing medications which is available over the counter. They can cause decrease in the prostaglandin levels, which decreases the blood supply to the kidneys. The blood supply, the blood vessels which are there, the dilatation will continue to happen because of prostaglandins. And we take medications for pain killing to reduce this prostaglandin so that the pain comes down. But the side effect is the blood supply to the kidneys come down because of the decrease in the prostaglandins, and that causes the damage of the kidney tubules or the filters, which are millions in number. Each kidney has almost 1 million of kidney urine blood filtering tubules. We call it as nephrons. So these nephrons starts getting damaged because of the painkillers. So it is advisable to only limit, and unless it is absolutely required, to take painkillers. And the damage to the kidneys by these medications, particularly painkillers, is completely silent. We will not know until the damage is too severe. So getting a regular health checkup every yearly to make sure that the kidney function is fine, with urine routine micro, renal function test, and complete blood count. Probably added to that, we can do an ultrasound scan to see the size of the kidneys or stones formed inside the kidney, or the tubes, and the urination, the urinary bladder wall thickness, the size of the prostate, the emptying of the bladder completely after the urine being voided. These are the tests which have to be done to see whether the kidneys are functioning fine, the urinary system is functioning fine or not. I've got another question here. Long-term sitting job and urological problems. Not very directly related to sitting problems. I would say we have had patients who come here with IT job, who continue to sit and without getting up for hours together. I would always ask them to get up at least 20 to 30 minutes once, go for a walk, have a glass of water, go to the loo, get the bladder get emptied 1 to 2 hours once. At least that will help to have a proper system in the bladder circulation. You can have a proper bladder filling and bladder emptying happening within 2 to 3 hours. That system has to be followed. And this job, people either drink more water continuously in a sitting position in a single posture, and or don't walk around, which causes a lot of stresses in the leg, and leg swelling can happen. So all these have to be avoided. So even if you're sitting in a long-term sitting job, once in half an hour to 1 hour, you get up, walk around, drink water, go to the bathroom and come back, get a washroom, bladder emptied at least 2 hours once. Washroom visit is required for that. Okay. Another question coming in is, does diabetes affect urological health? Yes, and as I mentioned, diabetes is one of the important causes for general organ involvement. All the organs in the body can be affected by diabetes. Any organ involving smaller blood vessels, particularly the heart, the kidneys, the fingers, toes, the brain, all these are affected by diabetes, because the diabetes causes smaller blood vessel narrowing, and can cause blockage and decrease the blood supply to these organs, vital organs. They can affect with erectile issues. They can affect the prostate involvement, scarring of the prostate, recurrent urinary tract infections. It can cause scarring of the kidney because of the decreased blood supply. They can affect the kidney functions, and renal failure can happen in long term uncontrolled diabetes and hypertension. And another question coming in is, smoking and alcohol urological problems? Yes, smoking, as I said, smoking also is an important factor, because they also cause decrease in the blood supply to the vital organs. It can cause peripheral vascular arteritis, which can cause problems in the heart, in the kidneys, in the brain also, and in the erection issues. So any blood supply decrease in the erectile tissues or the penis, to be specific, can cause erectile problems and fertility issues also. So fertility is directly linked to smoking. Alcohol, in other way, it can impact on the liver functions. It can indirectly impact on the kidneys because of the liver functions. It can cause a decrease in the waste disposal, and that can cause problems in the kidney functions also. Water intake, if alcohol intake is not properly managed with water intake, it can cause a lot of concentrated damage to the liver. Particularly, it can also impact on the kidneys to some extent, but liver are more prone to get damaged by alcohol intake. What foods are good for prostate and kidney health? As I already mentioned, water intake is very important. Healthy diet, particularly vegetarian, would always be preferable, even if there is a non-veg intake. Reduction in the meat intake to significantly have an impact on kidney functions, particularly in terms of stone formations. So water intake is very important. Other parts of diet would be salt reduction, like I said. So salt reduction and a good amount of water intake, I would say, it would be a general advice to everybody, so that it doesn't cause stone formation, it doesn't cause decreased blood supply to the kidneys, and the filters are very good working, so that all the toxins are diluted in the blood because of the good volume in the blood. So water intake, salt reduction. There are two important main things to be followed. Another question coming in: if a patient presents with blood in the urine with no pain, what would be your first approach, and serious conditions would be expected? So blood in the urine, we would never expect a urine being having blood. It can be microscopic or a macroscopic blood. It can be only detected in the lab, which we call microscopic. And when we see blood in the urine on a naked eye, then there's macroscopic blood or glass hematuria. And particularly if it is painless, we are more worried. If it is painful, then we know that there is a specific reason. Painful blood in the urine can be because of urinary tract infection, or can be stone inside the urinary bladder or in the tubes. If it is bloodless, if it is painless blood in the urine, then it can be a little serious issues, because we are thinking of bleeding which can happen from tumors inside the kidneys, inside the urinary tubes, or in the bladder or urinary passage. And that can be because of a cancerous growth. That is main worry for us. Other reasons for blood in the urine without any pain is prostate enlargement, which can happen because of blockage of the urinary passage because of the prostate, and sudden emptying of the bladder can cause something called as decompression hematuria. People having BPH or prostate enlargement can have increased blood supply or congestion of the prostate with blood vessels. Whenever there is a bladder being empty, suddenly the prostate will open up and shut down. So this process of opening and shutting down with an enlarged prostate can cause blood vessels being suddenly dilated and suddenly decompressed, and that can cause blood in the urine because of the prostate being very vascular and a lot of blood vessels coming in the prostatic gland, and they can suddenly rupture and cause blood in the urine. This is usually painless. So painless hematuria is more important for us to rule out possibilities of tumors or cancers inside the urinary system, or decompression hematuria. And there's a condition called jogger's hematuria, which can happen when the partially distended bladder we start walking or jogging, particularly that can cause flapping of the bladder walls, and that can cause rubbing of the bladder muscle mucosa to each other and can cause blood in the urine. We call it as jogger's hematuria. So it can be a completely benign condition. It can be a condition with prostate enlargement, or it can be a much serious condition like malignancies or tumors, or sometimes aneurysm can also cause blood in the urine, which may be painless, which can happen in post-surgical conditions, post-surgery to the kidney, PCA, post-stone surgeries on the kidneys or on the tubes. So there are relatively rare conditions. Uh, but these are the possibilities. So blood in the urine, which are painless, are significant and important for us to be evaluated. Okay, as I said, okay, blood in the urine and serious conditions, serious conditions, as I said, malignancies, aneurysmal growths. They can be conditions which can lead to blood in the urine without uh, pain. Okay, I have a question from Darling Khan. So, coenzyme Q and incontinence. I did not understand the question here. Yeah, coenzyme Q. These are the food supplements which can help into infertility, where lysine, coenzymes, ubiquinone, all these zincs, all these are required for good sperm productions, particularly for a good functioning sperms with good tail and good motility to generate. These are supplements, food supplements, which are usually given for patients with infertility. Regarding incontinence, yeah, I have not touched much about incontinence here. So incontinence, particularly in a male, usually we expect this to happen post-surgical or after any surgeries for the lower urinary tract, or after a patient having lot of bladder outlet obstruction because of prostate enlargement, or obstruction of the urinary passage because of a stricture of urethra. Stricture of urethra is the narrowing of the urinary tube apart from the prostate gland, and this can happen in younger individuals above 40 years, maybe because of old trauma in their 20s or in their teenagers, or because of urinary tract infections which has caused narrowing of the urinary passage of the urethra, and that can cause blockage of the passage, cause leading to urinary tract infections. And because of the urinary tract infections, and if the scar is particularly at the level of the sphincters where the muscle controls the urination process, there can be incontinence of urine. Incontinence can also happen in case of traumas or neurological conditions, which can be affecting the nerves which are supplying the bladder muscle and in the sphincter region. So it can become a completely what we call it as neurogenic bladder, which can cause incontinence, where the coordination between the bladder muscle contractions and the sphincter relaxations are affected. So normally we know the maturation cycle is such that the bladder is completely relaxed till the bladder volume is filled up. When the bladder starts getting filled up, the muscles and the inner layer will start having nerve signals which are sent to the brain to make sure that the body understands, or the brain understands the bladder is getting filled up, so you can have the sphincters completely tight so that the urine doesn't leak. If there is any circulate damage within these circuits, and nerves are damaged all through, either from the bladder end or in the spinal cord or in the brain, they can have an impact on the cycle of this. So that even with the bladder being very full, the sphincters are not very tight and they start relaxing and the urine starts leaking. So incontinence has its own aspect, particularly in a male patient. Since we are talking about males, it can be because of prostate enlargement, it can be because of recurrent the urinary tract infection, or stricture of the urethra, or neurological problems involving the bladder or the sphincter area. So I have another question coming in: urological rehabilitation for the management of wait a minute. Role of urological rehabilitation management of common urological disorders. Rehabilitation, rehabilitation for long-term urological problems. I would say a proper toilet training, which will help the urination process to completely take a proper circuit, bladder being filled up, the brain should get a sensations. if the sensation is abnormal, or they may need rehabilitation when the whole process of the circuit is interrupted. So in those cases, this usually happens in neurological problems affected by neurological deficits, either spinal trauma, injury to the nerves, long-term diabetes and hypertension causing neurological damage, and they are rehabilitated either by doing a what we call it as a suprapubic catheterization. We put a small hole just below the umbilicus into the bladder, where the diversion of the urine, normal drainage passage of the urine is completely taken away from the function, and the urine drainage happen from the tube which we place, or a catheter we place in the bladder directly. So that all the urine which is collected inside the bladder, which will come out of the urinary, the catheter we place, and it will collected in the bag, and that is disposed of whenever it is filled up. So this is part of a rehabilitation. If there is any sphincter incontinence because of the damage, muscle actions or muscle sphincter actions to start on, we train patients with something called as Kegel's exercise. And if the Kegel's exercise are not, or fail to have this continence properly, the urinary the muscles or the pelvic floor muscles to become tightened, we have a process of biofeedback physiotherapy. We call it as jogo, or jogo device, which where we keep electrodes or probes near the muscles where the contraction should happen, and that is monitored based on the patient's performance on the physiotherapy exercises. So whenever the patient starts doing exercise, we see contraction of these particular muscles, which will help the patient to have a continence. So this is how rehabilitation, if there is reversible and muscle weakness, exercises in the form of Kegel's exercise or Jogo biofeedback physiotherapy. If everything fails, if everything fails to recreate the normal neurological circuit for bladder to function properly, then the only dead end alternative for us is to place a suprapubic catheter, which will continuously drain the urine without the continence and the incontinence mechanism to work at all. So this is how the rehabilitation we do in these kind of conditions. Okay. Anything else? I'm not getting any questions as such. I think this should be enough for the time. Any questions? We can be communicated to our team here at section at Nagarbhavi Fortis Hospitals, and please do find time to take care of your health. Have a good amount of water. Stay healthy. Thank you. Thank you for the patient listening here.